James Andrews was once inducted into the Alabama Sports Hall of Fame. He is not an athlete. He is an orthopedic surgeon. He's now written a book about how he's helped some of the biggest names in sports come back from devastating injuries. Mark Strassmann is at the Superdome in New Orleans. Mark, good morning.
Good morning, Charlie. Pro football, violent game, of course, and people do get hurt for all of the excitement. And so NFL agents and sports executive here always carry around the phone number of one doctor the way the rest of us do our family physicians. They know that Dr. James Andrews is a one-man powerhouse of second chances.
And Robert Griffin III is down on the ground and can't get up.
When Washington rookie quarterback Robert Griffin III tore his right knee earlier this month, the Redskins turned to their MVP, most valuable physician. Dr. James Andrews, arguably the most renowned orthopedic surgeon in all of sports. That's why elite but broken athletes, college and pro, flock to the Andrews Institute, a surgery center and rehabilitation clinic in Gulf Breeze, Florida. But no piece of equipment here gets worked out more than this cell phone.
I did your center. Was it year before last? How'd that work? Be glad to help you. Sorry. Okay. All right. Bye-bye.
How often do you get phone calls from an agent, an NFL general manager, or an athlete himself saying, I need help?
Well, I've had probably 5 or 6 this morning. That's a common place that goes on my cell phone 7 days a week.
Andrews, now 70, could open a multi-sport Hall of Fame in his operating room. His patients have included Michael Jordan, Brett Favre, Drew Brees, and both Manning brothers, Peyton and Eli.
When I started, sports medicine wasn't even a word. We all wanted to be team physicians. That was the big word back in those days.
In those days, the 1970s, orthopedic surgeons usually repaired a damaged joint by cutting it open. Andrews pioneered the arthroscopic approach for knees, shoulders, and elbows in the OR. Less invasive, less traumatic, faster recovery.
Up until that point, you had to open the knee wide open to see anything, and even then you really couldn't see. So the arthroscope was, for me, the #1 revelation in sports medicine over the last 40, 50 years.
In 1984, golf great Jack Nicklaus brought his damaged knee to Andrews' OR.
That really put me on the map to some degree. Then along came my career in baseball, and that signature patient was Roger Clemens.
Was there a football patient that did the same thing for you?
Bo Jackson. He was a challenge, multiple phone calls every day.
These are marquee names. Is there a lot of pressure that comes with that, knowing what the stakes are?
People expect you to fix them regardless of how big a problem they have, and the pressure builds and builds and builds. You got to have a special personality to handle that. Tell me a little bit about when it gave way on you a little bit.
Yeah, I just got up, kind of just gave out.
In 2007, he opened the Andrews Institute, a sprawling $40 million complex to go along with the Andrews Sports Medicine and Orthopedic Center in Birmingham, Alabama.
It's good to see these guys when they're recovering, right?
No kidding.
Recovering to their former dazzle. This past season, Minnesota Viking running back Adrian Peterson rushed for his 2,000th yard. He did it 1 year to the day after Andrews repaired his left knee.
Every time we tackle him, get up, get up. Hope you're okay. But there was some anxiety watching him this year, believe me. But there was also some joy.
But for Andrews, nothing matched being in the stands for Super Bowl 44 3 years ago, when the New Orleans Saints played the Indianapolis Colts.
The thing that really caught my eye, out of the starting 22 players for the Saints, 12 of the 22 I'd operated on.
He had also operated on 9 Colts players, 21 of the 44 starters on offense and defense for both teams.
To know that I had in some small way, some relationship with those two teams that were playing, that was probably as high a mark in my career as there ever has been.
Andrews wrote his book to help stop what he calls an epidemic, serious sports injuries among kids. And his institute is now researching stem cell technology, which he considers to be the new frontier in sports medicine. Charlie and Nora?
And Mark, it's amazing one guy could have so much influence. And the other thing that interests me about this, if he's the surgeon for RG3, in his hands rests the future or the near future of a franchise.
No question. I mean, he's been the guarantee in many respects of a second chance for the players of the NFL for the last 30 years, and probably for at least the next 10, because he says he has no intention of retiring.
Thank you, Mark.